Hello, everyone. My name is Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference, and I'm so excited to have this panel with Big Health and EY to discuss addressing mental health equity in the workplace from the perspective of a digital therapeutics company, as well as the perspective of an employer. Welcome, everyone. Thanks so much for being here. Why don't we get started with a few introductions, starting with Dr. Carl.
Hi everyone, I'm Jenna Carl. I'm a clinical psychologist and I'm the VP of Clinical Development and Medical Affairs at Big Health. So at Big Health, we create fully automated yet personalized digital programs for common mental health problems. And they need to be evidence-based, but also highly engaging. So it should feel like entertainment as medicine. And at this point, we have two digital therapeutics, Sleepio, which is focused on poor sleep and common overlapping areas, as well as Daylight, which is focused on worry and anxiety.
I'm Mike Weiner. I am the director of Ernst & Young's Employee Assistance Program and Work-Life Services, which we call EY-Assist. I'm a mental health clinician, and I manage also a small team of clinicians internally and a number of vendors that together comprise our EAP program.
Hi, and I'm Dr. Juliette McClendon. I'm a clinical psychologist, and I am the Director of Medical Affairs at Big Health. And my specialty area is in mental health equity and the impact of racism and discrimination on racial and ethnic disparities in mental health and mental health care use.
Thank you all so much. I'm really excited for this panel. Why don't we get started with Jenna, can you help us understand what are the implications of large-scale mental health inequity on millions of untreated sufferers, not only for those suffering in silence, but also for employers?
Sure, yeah, thanks. So let me start by saying in the baseline for mental health is that very few people at all are getting access to evidence-based care. So, the research shows that it's really only about 40% of individuals who have a mental health condition who would, meet diagnosable criteria are getting access to any mental health care. So 60% of folks are just not getting any care. But when you think about layering on the inequities that affect different populations, then we realize that there are really significant disparities in who is getting access to care. So that group that's getting access to care is not, equally representative of all folks. And so there, for people of color, for sexual and gender minorities, immigrants, folks from all different kinds of backgrounds, they are going to be disproportionately at risk of not getting adequate mental health care. So they will be even more represented in that silent suffering group. Now, that obviously means for those people that they are experiencing greater suffering, greater impacts on many areas of their life. It could be relationships, but of course, it's also functioning at work and productivity, things like that. But then more broadly for employers, it means that unfortunately, the health systems within the employer are reinforcing those very mental health inequities because they're greater, servicing, those from the majority group and less so those from marginalized groups. And it also means that the employers then unfortunately are not able to support, people from marginalized backgrounds in terms of being as successful as they can at work and really optimizing their, career paths and things like that. So it's a lot of implications for both the individuals and the employer as on the whole.
Yes, absolutely. Mike, I want to turn it over to you next. From an employer's perspective, is mental health equity a focus area for you? And if so, how are you addressing it at EY?
So that's a great question, and it's a complex problem. There are many challenges that impact access to mental health care. I mean, there's quality of care, there's provider availability, and there are just like in the medical community, and there's been a lot of research coming out about this recently, there are not enough culturally sensitive mental health practitioners, practitioners of color, Pan-Asian providers, mental health providers, just as Jenna had mentioned. We've done a few things at EY to address these concerns. So first, we held virtual listening sessions. This is throughout our EY US offices to discuss social injustice, increased violence that's been impacting our country. And it became quite clear as we were listening to our people. We had these meetings throughout our regions at EY. It became quite clear that people were having difficulty, at EY, finding mental health practitioners that were culturally sensitive, that were a good fit for them. Difficulty finding providers of color or Pan-Asian providers, and then we knew and we understood that that these issues it really created an additional hurdle, an additional challenge, and for some really a barrier to accessing care. And we landed on the following to address this. So one is that we asked our mental health vendors to weave questions into their telephonic intake process regarding any cultural sensitivity needs for the referrals that they were seeking. They were very receptive to the feedback that we provided. So that was one piece. The other thing that we did is that we now have a mental health vendor that has updated that now has the ability for people to see the bios and photos of providers that are on their network, so people can make an informed decision about connecting with a mental health practitioner before they actually have their first appointment. These are just a few things that we've been doing. We've been continuing to have these listening sessions. We do not have this issue solved, but we feel that we're making progress.
That sounds great. And even that kind of progress is really exciting to hear about. I'm hoping more and more employers start implementing those kinds of tactics. Now, Juliette, if I could turn to you, what are some of the reasons that underserved populations often don't even seek out care in the first place?
That's an excellent question. And I think it's a really important question. And also it really sets the baseline for understanding really how can employers and other entities and institutions intervene to improve the access to high quality mental health care among underserved populations. So there are a number of barriers to accessing mental health care for underserved populations. And a lot of them really center around social determinants of health. So these are social factors in the environment that impact people's ability to access or engage in health promoting behaviors and health promoting resources. And social determinants of health can be barriers for anyone, but in particular, they affect underserved populations disproportionately. So first I like to think about it in a few different buckets. So first we have like logistical barriers. So those are things that others have mentioned, like time, schedule, affordability. Many people do not seek out healthcare because it's too costly. Or even if they do have insurance that covers it, they may still need to pay a copay, or they may only be covered for, let's say 10 sessions, and that may not be enough to actually target and get at what it is that they really need help for. In addition, when we're talking about in an employment setting, when we're talking about employees who are working, oftentimes there's a difficulty of being able to get, from take time off work on a regular basis. Oftentimes traditional mental health treatment is weekly, getting that time off every week, being able to get to and from the session. If you're doing telehealth, finding a private space to be able to engage, making sure you have childcare. So there's a lot of things that factor into even having the time to engage. In addition, the limited provider base has been mentioned, and I want to add something to that, which is not only are there long waiting lists for therapists or for mental health clinicians, but it's also somewhat difficult to navigate the process of finding a clinician who is going to be a good fit for the individual. And so that can be very challenging in and of itself. And if somebody's really suffering, it can seem like an overwhelming task to find the right fit. In addition, people are not always aware of what are the evidence-based treatments, what has been shown to work for different problems. And so they may be looking for a therapist, but not know exactly what they should be looking for that's really going to be helpful to them. And then the last thing I want to bring up is stigma. And I think this is a huge one. So there are a number of ways that stigma operates. But stigma is basically this idea that people may have misconceptions about mental health disorders or mental health treatment. And sometimes those misconceptions can be based somewhat in reality. That keeps people from seeking care. So individuals, for example, people of color or people who are underserved already or who are from marginalized groups may have a fear that if they go to therapy, then they may be labeled with a mental health condition. And then that adds another stigmatized label on top of the sort of stigmatized identities they already have, like being a person of color or being a sexual or gender minority. So that's one thing that may keep people from seeking treatment. I think in addition, because, therapy was generally created for individuals who have a lot of disposable income, who have time, middle class, sort of white individuals, that oftentimes people from underserved groups may not see therapy as being for them, which is not always the case, but I think which really can get in the way of people sort of taking that first step to trying it out. And then finally, many underserved populations prefer to get care and to talk about their problems with trusted community leaders. Oftentimes there's this taboo of like, don't talk about, dirty laundry outside of the family. And so that can be another reason why individuals choose not to seek sort of outside professional help for what they're going through.
Can I add something to that too, which is I think you covered so many of the key, key factors, Juliette. But you were touching on, some of this distrust that's been built up over, over decades for many folks from marginalized groups with healthcare practitioners. And, I think some people assume that mistrust is from, incidents like Tuskegee and things that are, really far in the past. But that's just not what the data show. In a recent study, 53% of individuals reported they experienced microaggressions in therapy, and this is this is today. And so, if you're experiencing, microaggressions being, small, maybe unintended, but, moments of discrimination or racism, that's going to continue to pull you away from wanting to access traditional types of care. So just many things kind of, adding on to each other to create a system which is not inclusive enough.
Absolutely. And I think the big thing there is that stigma is not just based on the individual not understanding, mental health conditions or mental health care. It also comes from actual experiences people have had in mental health care and healthcare in general.
This is Mike, if I can jump in with a comment as well. That we've been recognizing this and addressing this at EY as well through our listening sessions, and part of the listening sessions that we've done with our people is that we had people share their stories. Some of our leaders sharing their stories, peers of our team sharing their stories of how they've been struggling during the pandemic, for example, and what's been particularly impactful when someone sees someone that looks like them saying, I'm struggling with this and I went to get care, it normalizes it in a very, very powerful way, much more so than a benefits communication, where here's a resource, please access it. So when you have peers, colleagues, people from your community accessing care and saying it's important, so we found that has also helped to move the needle as well. So something we feel quite strongly about, and we're continuing that effort.
Absolutely. That's fantastic.
Yeah, really great insights all around. Thank you each so much. And continuing on that thread a bit for Jenna, for Jenna, it seems like today's system of in-person or virtual therapy for that matter really caters specifically to affluent white professionals as opposed to frontline workers, um, minoritized communities who have less flexibility in their schedules and lack of disposable income for therapy. What is it that we can do to change this?
Yeah, that's a great question. Yeah, the typical hours of mental health clinics or mental health private practice providers is 8 to 5, 9 to 5, exactly overlaps with the standard shift work. And so for folks who don't have flexibility, we just need to provide additional offerings. And so, the simplest are providing, the same types of in-person care in off hours, and that's something, evenings or weekends, things like that. But again, that's still going to be inaccessible to many. You think many people are stretched between work and responsibilities outside of work, whether it's caregiving or other things. And so, actually thinking more outside the box and providing different types of mental health care services that can meet everyone's needs, I think is what's needed. And so there's all kinds of different offerings now that are starting to emerge, particularly in the pandemic landscape when it's really been clear that traditional care, is unable to meet everyone where they're at. And so, there's digital solutions, which, ours at Big Health are one example, of course, that are, fully automated. And so individuals can access them at any time that they want and, get the actual, the evidence-based techniques to use in the moment. There are other, text-based programs. There are, peer-to-peer type support programs. Granted, I mean, those from a clinical standpoint, those really do need a lot of safeguards in place to make sure that they are, effective and that there's no risk. That's really important. Can't emphasize that enough because some have, some are maybe not approaching it with as much kind of governance as needed. But in any case, that's where I'm thinking, we need to be going more in the direction of is just much more flexible options that people can access in small amounts of time, not necessarily during work hours, and make sure that what they're getting is still evidence-based care, because otherwise it becomes we're providing, subpar care, outside of that standard schedule, and that means that we're still kind of reinforcing inequities of care.
And I'll add that one thing that's really nice about our digital therapeutics is that people, and any digital therapeutics really, is that people can access them really anytime, anywhere. And since they're fully automated, they don't require a person to connect with. And so you only really have one person's schedule to worry about, which is your own. And so it really, really adds that flexibility to when people can engage in this kind of intervention.
That's really helpful and super promising in terms of expanding access. Mike, if I could ask you, what role do you see digital therapeutics playing in helping those close the mental health equity gap?
So, first off, there isn't a single mental health solution that works for everybody. So some prefer traditional counseling, some prefer self-help books, others prefer digital therapeutic tools, some prefer medication or a combination of any or all of those. So at the very least, digital therapeutics, especially those that have been validated in clinical trials, can be effective, for those that have limited access to care. For those in therapy also, I personally believe that digital therapeutics is a great addition to reinforce work that occurs in between appointments. So now to the question. So furthermore, I would say that digital therapeutic tools that use and have diverse images of people on its platform, in their member communications, in the also in employer communications that relate to that tool, can help that digital therapeutic tool resonate with their entire workforce, and can help close the mental health equity gap. It's important, for employers and for vendors that provide digital therapeutics, in my opinion, to be very mindful of the imagery that they use when they're communicating those programs. That actually, I really think that is as well as with any benefit that's being recommended, that it goes back to the story sharing, and as mentioning before, of people saying, yes, I am using whatever it is, it's helpful for me. It's the same thing with digital therapeutic tools, and just to increase awareness and acceptance that this really can be a very effective tool for people. And the last comment I want to make about this is that, okay, all these resources can be helpful, but another very important aspect of mental health and well-being is about workplace culture. And we can't diminish that or forget how important that is. So workplace culture, workplace processes to promote well-being, disconnecting, taking breaks, checking in with each other are all essential aspects of well-being, as well as promoting effective benefits and tools like digital therapeutics.
So, Mike, I'd love to understand, obviously everything we're talking about is very important and has the possibility to make huge impacts on so many employees and individuals everywhere. But from the employer perspective, where do you see mental health on the list of priorities for employers, and how do they sort out the various ROI and effectiveness of these solutions?
Well, COVID has brought the criticality of mental health and employee well-being to the front and center, I would say, of every workplace. Um, but that's actually one of the benefits of COVID, is that many workplaces have been creating heightened awareness, encouraging their employees to address and seek support for their mental health, for personal struggles that may be occurring. There are many workplaces that are having story sharing events talking about the stigma of mental health. I hear from colleagues of mine in other organizations that it's definitely growing. So that's a good thing. Still a lot of work and growth that needs to occur with that, but it's hopefully the beginning of a trend that will continue. And we're definitely doing much more of this at EY than we have ever done before, through internal communications, listening sessions, webcasts, team events, office-wide virtual right now, office-wide events have led to the highest utilization of our mental health resources, our employee assistance program, and other tools, highest utilization than we have ever seen in our 40-year history of having our program. So for us, we see that all of these efforts do help address the stigma and help people recognize when they're struggling, when a colleague is struggling, and to check in with them, can move the needle that more people will be getting care. So that's one piece. Now, to address the second part of your question about ROI and effectiveness of these solutions, for me personally, I don't give ROI too much weight and focus in making our decisions, because there are just too many variables to be able to say we did intervention X, we added this particular benefit or a vendor, and therefore we saw a change in something and a macro solution. Because of COVID, there's just, that's just the perfect example. There's just way too many variables to say that one particular intervention had an impact. However, that's ROI. For me, what I look at is the effectiveness of a particular solution. And that starts with looking at solutions that have been tested and validated, published studies that show that those that use that particular intervention can see a real benefit, that there are outcomes that demonstrate that it works. There are thousands of apps that are available that touch on mental health. I mean, how does an employer figure out which of those thousands would be a good fit? Well, for me, not the ROI. The first is to look at which are the programs, tools that have studied independent studies that show that their programs work. And then, as I was mentioning earlier, there's a segment of the population that digital therapeutics will resonate with them, and an employer can it's through their due diligence can help identify which are the tools that actually have been vetted to show that they work, because there's great variability in the tools that are out there. So that would be my recommendation, is for employers: take a look at published studies, ask for published studies if you're considering a tool, and if there are programs that have tools that are in process, say, okay, or publications in process, will keep us informed, and as that progresses. But that's my personal tactic in managing, because the number of tools that are out there. First of all, it's wonderful to see the investment that's occurring right now in mental health, to recognize that just the way that we've been practicing supporting mental health care in the past, which is just traditional therapy, is just one solution. And I'm so excited to see that there are organizations looking at AI and other technologies through study to really use the information that's out there to show effective solutions to help people not only get better, but to get better quicker.
I totally agree with Mike, and I'll just add that, I just joined Big Health, and I was really proud to do so, because we're really leading the field in terms of having evidence, gold standard evidence for our products. And I think that is really crucial, because you can make something that sounds good and that looks good, but at the end of the day, if it doesn't work, it's wasting your employees' time, and it's really important to get solutions that work into the hands of your employees.
Yeah, and we're talking about mental health. We're not talking about transportation to work, or we're talking about healthcare. And so we need to be thinking about meeting the standards of healthcare. And for all areas of medicine, it's important that there is published research, as Mike said, and that it backs up the specific intervention. And I think that digital health, digital therapeutics, it's a new area. And so there's this lag in sort of the standards catching up with the practices. But I think it's really important that everyone realizes that it's people's health that's in our hands. And therefore we need to have high standards that align with other areas of medicine. And so, it can't just be that there's evidence for cognitive behavioral therapy. There have to be evidence for the specific interventions that people are using within their health plan or employee population. So so great to hear you say that, Mike, because we're just hoping that the field really starts aligning on high standards of evidence. That's going to be very critical from from an equity standpoint as well.
Well, there's so much more that I would love to ask each of you. This has been incredibly insightful. Thank you so much, each of you. Dr. Carl, Dr. McClendon, for your leadership at Big Health. Likewise, Mike, for your leadership at EY on this important topic. And thank you so much for joining us today.